On now to continuing the conversation in cancer prevention and early detection, teaming up against cancer. We want to welcome Steve Abbott, Dr. Brooke Edwards. Tell us who you are and what you do.
Thanks, Liz. My name is Steve Abbott. I'm Executive Director of Cincinnati Cancer Advisors. So we are a free oncology consultative service, basically. So we partner with a patient's doctor who goes back and they're treated by their oncologist, but we're just in a consulting role, basically, doing research on their behalf and working directly with the doctors.
And you are a survivor.
10 years this year, prostate cancer survivor, advanced prostate cancer, which we, as Dr. Edwards know, back in the day, there weren't the type of diagnostics that could tell you that right away. It took a little time to figure that out, but advanced prostate cancer, meaning it's distant. It's been other parts of my body other than behind the local area where the prostate's located.
Well, we've got an update on that for you. We're going to share shortly. But Dr. Brooke, tell us who you are and what you do.
I am a urologist at the Urology Group here in Cincinnati. I see patients here in the tri-state area, but I also serve as our chief medical officer for the group.
And your passion is prevention.
Of course. Within urology, there's a lot of prevention that's needed for both men and women, especially this month. We're talking about men and prostate cancer, but it covers the gamut within the urology world that a lot of patients don't realize.
And don't even know or think about. They're not talked about as much and that kind of thing, which is why we're so glad you're both here today. We do want to just give you a quick update and share with you a story, though, however. We ended up hooking up with Steve because you mentioned you were on a medication that was hard to find or wanted to be treated with it. And so when it comes to the drug shortages right now, what you found is you have to be your own advocate. So we're sharing just a little bit of Steve's search for that drug to save his own life that's been in short supply. Listen to this.
I waited about 6 months from the time that I knew that I needed to be on this treatment.
The treatment is called Pluvicto. Steve Abbott was finally able to get his first treatment by infusion here at Ohio's Urology Group. It is what's called a radiopharmaceutical drug made by Novartis, which provided this manufacturing video.
It specifically will attach on to a part of the cancer cell that has a membrane or base layer called PSMA.
Once it attaches to that PSMA target, it can inject the cancer cells with radiation and destroy them. The only problem?
The medication really has been somewhat on shortage since the beginning.
Dr. Brooke Edwards told me the medical supply chain problems were magnified in the pandemic.
Whether it's cancer related or not, we just do not have product many times.
The FDA says at least a dozen other cancer drugs are also in short supply. So doctors are swapping to similar medications if possible, or trying to find the drugs outside the U.S. Steve's treatment had to come from Italy because there is no other like it.
This treatment is very impactful. A lot of advanced prostate cancer treatments kind of manage the condition, but this is showing actual quantifiable extension of life benefit.
So after searching and waiting, here's what Steve Abbott wants others in the same struggle to know.
To a certain degree, you have to empower yourself to ask the right questions to make sure that you're being enough of your own advocate.
He'll know in a few months how well it's working and feels it's every bit worth the effort.
Now, just wanted to let you know, I know there were some insurance questions. You got it covered. We got you treated. And for people not familiar with this drug, he said he's kind of radioactive for a couple days. What's happening there?
Some of our drugs that we use, because of the mode of action is radiation, there are some precautions as far as being close to others or children or women that are pregnant. Depending on the drug, depends how long that lasts. For some, it's a couple hours. For others, it can be weeks to a couple months. So it just depends.
Yeah, it's so interesting, but I don't want to get too personal, but am I allowed to ask how you're doing? You've had a couple treatments now, right?
Yeah, no, I just had my second one last week, but I got my first PSA, which is kind of it's not a perfect, but it's a measure of disease volume. And whereas I went into that first treatment somewhere in the 22 to 25 range of my PSA, it's now down to 9.6, so it's fallen more than half after the first treatment, and hopefully it'll just continue to do so.
I feel your elation. I mean, there's nothing better than seeing, progress. But one of the reasons we wanted to hear is this is Men's Health Month, and, that is a marker, as you say, not perfect. But what do you want especially guys, to know, as we're looking at that, because that number kind of, we hear it and it goes up, it goes down. What is it that we can share? Because you said finding it early really can make a difference in these kind of things.
Yeah. I think the first thing is knowing your family history, having conversations with your father, your brothers, your uncles, to understand what runs in the family. Is it cardiovascular disease? Is it prostate cancer? Is it breast cancer for the women in the family? Because that can be a good sign that you may carry a genetic mutation that also causes prostate cancer. So those open conversations are very important. The conversations with your family doctor are important. And seeing a urologist. If you don't feel like you're getting the information you need or your questions answered, then meet with them and establish care with the urologist, and they'll be happy to have those conversations with you.
We have just a little video of your team, but Steve, what do you want people most to know? Because I know you have been such an advocate for education.
Well, the thing I would like people most to know is that, and Dr. Edwards and I were talking about this off screen, but there's so much in the pipeline. And so, whereas you think about the things I've had recently, chemotherapy, which wasn't certainly wasn't that beneficial for me, but Pluvicto is already showing signs of that. But as an example, Pluvicto, you have to have failed chemotherapy in order to be on Pluvicto. So, but there's so many other, there's other PSMA targeted treatments that are coming that are showing good efficacy. So just stay hopeful, stay on it. Don't give up, and live your life, because I put on a little bit too much donut weight around my middle, but other than that, I'm doing great. And so, and I think Dr. Edwards would agree, 10 or 20 years ago, I wouldn't be doing this well. So there's a lot to be hopeful for.
Right. I think you feel like if you know, you won't have options, and there are options.
Yep.
Yeah. Well, we are so grateful to both of you just for sharing your story, for continuing to put the word out. I think the whole urology thing is very intimidating, so it's nice to put, faces and people with what you can know, second opinions. We do want to make sure if you need to get a hold of either of these people, they would love to have a personal conversation with you. You can find a link to both the Urology Group and to the Cancer Family Advisors. They give second opinions, and they make things happen. As you can see, like Steve is not afraid to advocate for you, and we love that you're part of that
I was a
group.
patient first. That's what made me want to work there.
Very personal. And that's at what'shappeninginhealth.com. Thanks for being here today, guys. Great to update.
Thank you.
Great story. All right, just ahead.